In 2025, Nigeria budgeted the sum of 2.48 trillion naira for the health sector, representing 51.8% of the total 47.9 trillion naira proposed budget. That ought to transform the health sector. It's therefore shocking when the health minister told the House of Representatives that out of 218 billion naira capital budget, a mega sum of 36 million naira was released.
The last money that we had grant for vaccine financing was 2024. Even that was not complete. Yet we have continued to immunize Nigerian children to protect them from diseases. We have outbreaks that will protect Nigerians. We did a massive measles and rubella campaign. But the counterpart funding that Nigeria should put is always late in coming. How do you explain that?
0.016% was released. Where is the other money?
However, this is not a problem. Records show that this is a recurrent trend. In 2022, 134.7 billion naira was allocated for capital projects. However, 87.3 billion naira, that is 45%, was released. Going over to 2023, 134 billion naira was allocated for capital projects. However, 40.4 billion naira, which is 30%, was released. That is 10% down from the previous year. And if you look at 2024, 434.8 billion naira was allocated for capital projects. However, 65.4 billion naira, which is 15%, and further 15% down from the previous year, was released. Specifically for 2025, 402 billion naira was budgeted. The amount released is unknown. On Basic Healthcare Provision Fund, the budget was 282.6 billion naira, but only 32.9 billion naira was disbursed at the end of 2025. How does this impact on the healthcare sector?
First, the Basic Health Provision Fund is actually to achieve universal health coverage by the year 2030. And if what is released is less than 20%, then it's not possible for us to achieve universal health coverage by the year 2030. Remember that it's divided into 50% of that money is going to go to the primary care facilities all over the country. And now we don't have that money. So how are the vulnerable going to access it? How are people going to access it? About 20% is going for medical emergencies. Of course, that means that any emergency that occur in this country is on their own.
In the 2025 capital budget, provisions were made, among other items, for the construction of healthcare facilities, equipment, immunization programs, renovation of 8,000 primary healthcare centers to improve access to healthcare in rural areas, of which these were not achieved.
Most of the primary health care facilities are moribund. The facilities are non-existent, more or less. Same thing applies to secondary, and sadly, even the tertiary health facilities. So you have lack of equipment, lack of infrastructure, there's no light, there's no water. I mean, we are in a very ridiculous situation.
Is there any wonder our health facilities today, with hospitals struggling with inadequate resources, leaving healthcare workers frustrated?
The number of people we're supposed to cover in a day, we are not going to be able to cover it because we are carrying out some manual practices using some old archaic equipment. So it slows down our work, making us not to be able to attend to the number of people we are supposed to attend to.
How much of National Assembly's capital vote was withheld? How much of the capital vote to the presidency were withheld? How much of the capital vote for which ministers do travel, National Assembly members do constituency projects, how much of those capital votes were withheld?
At a time when Nigeria seeks to accelerate universal health coverage and strengthen primary health care, such extreme under-release of capital funds threatens not only health outcomes like infant mortality, maternal mortality, reproductive health, but also economic productivity.
Many health projects co-funded by international donors are also stalled and patients are suffering.
The Abuja Declaration says 15%. Is it possible? I mean, this is so many years running, since the year 2000. We have never met that up. But it takes political will.
This is not just a health crisis, it's a national emergency. Every Nigerian is affected, from pregnant women to children and from rural communities to urban areas. The big question is, for how long will the nation continue to fail to provide adequately for the health of its citizens? Olije Wapera, Arise News.